Hi, my name is Michael Acevedo. I will be performing my IV administration of fluids with a piggyback of an antibiotic. I first and foremost, I'll do a hand hygiene. After I do a hand hygiene, I'll go ahead and place my gloves on. I have gathered all the necessary supplies here that I need to perform. First, I'll go ahead and show the components of the IV set that I will be using. First one here is I have the IV line with the white port. This is the spike that I'll be puncturing the IV fluid bag with. This is the chamber for the fluid, along with the roller clamp. Right now it's in the off position, and so it's rolled down so no fluid will go through once I puncture the bag. Here is the white port where I'll be connecting my piggyback of IV antibiotics. And here is the luer lock side for me to go ahead and place onto my patient's IV access. So go ahead and put this to the side. The next one I have here is the piggyback connection, my IV extension kit, the piggyback. So we have pretty much the same thing without the white port. So you have the spike here, along with the drip chamber, along with the roller clamp. I'm going to close it in the off position, and this is the port that goes, the luer lock that goes to the white port. It's still capped, still sterile, everything's in place. Now I have everything here to go ahead and administer my medication and fluid. So I did calculate the fluid and medication. So fluid we have on hand is 150 mLs. Our drip rate is 15. So we take the 150 mLs times that by the 15 drops per minute. Divide that by 1 hour to 60 minutes. We get 37.5. So we have to round that up, which becomes 38 mLs per minute. 38 drops per minute, I'm sorry. Next, we have our medication using the drip rate of 15, times that by how much we have on hand, which is 100 mLs of fluid. And then we divide that by 15 minutes, which we get 100 drops per minute. Medication we'll be administering would be the amoxicillin. And we'll go from there. Once I enter the patient's room, I'll go ahead and introduce myself, give the patient privacy, let the patient know what I'll be doing for him today or her today, and I would go ahead and make sure that I have the patient's allergies, or that I know the patient's allergies. I would go ahead and look at my order once again and compare it to what I have. So I'll go ahead and look at the amoxicillin bag, and then we have the fluid bag as well. Everything's good within the expiration date and everything. Still sterile, hasn't been used or anything like that. Next, I'll verify the patient by asking what his name is and have him repeat it back to me, along with his date of birth. And then I'll do the second identifier by looking at his wristband and comparing that to the MAR or chart as well. Got to remember the 5 rights. The 5 rights is the right patient, right drug, uh, right route, right dose, and right time. After that is completed, I'll go ahead and start to spike my fluid bag that I have here hanging already. So what I'll do is I'll go ahead and take my IV set with the white port. Get that all ready. So I'm going to go ahead and remove the blue cap from the IV bag. I'm just going to throw that away. After I've removed it, I'm going to go ahead and remove the sterile cap from the spike. Throw that away. I'm going to go ahead and puncture the bag now. The clamp is in the closed position. I'm going to go ahead and spike the bag now. You want to get it flushed to the bag. Once that's done, we'll go ahead and squeeze or prime the drip chamber with at least half fluid. Okay, now that we have half fluid, then we're going to go ahead and release the place the roller clamp onto the on position to go ahead and get the air out of the line. I'm going to go ahead and place this cap on the side. So I'm going to go ahead and release some fluid. I'm going to go ahead, get all the air out that we need. Move all the air out of the line. Get a few drops out. Okay. I want to go ahead and inspect the line, making sure all the air is out. Once I know all the air is out, I'm going to go ahead and calculate my drips, 1 drop per minute, by counting the drops in the drip chamber for 1 full minute, making sure that it equals to 38 drops per minute for the fluid. So I'm going to go ahead and make sure I watch my watch for 1 full minute and count. Okay, 1 full minute, 38 drops per minute for the IV fluid solution. Going to go ahead and cap this back on. Go ahead and place this to the side. Next, I'm going to go ahead and get my secondary set. And I'm going to go ahead and do the same thing as I did with the fluid bag. I'm going to go ahead and remove the cap, throw that in the trash. Remove the blue cap off here, throw that in the trash. And then I'm going to go ahead and spike the bag. Roller clamping in the off position, close position. So I'm going to twist until we are met at the end. Perfect. Next, we're going to do the same thing. Remove the air out of the line by removing the cap from the lure lock. And then I'm going to dump and get some fluid in the line and release any of the fluid. Release the air out of the line. Get a few drops. Get all the air bubbles out. I'm going to fill the chamber about halfway. Once we do that, we'll go ahead and inspect the line that there's no bubbles or anything like that in the line. Now we're set to go ahead and count the drip per minute for the antibiotic medication for 1 full minute. Just like how we did the first bag, we're going to count out to 100 and make sure that it's 100 drops per minute. I'm going to go ahead and start. Okay, now that our medication bag is primed, set to the right calculations for 100 drops per minute, we are going to go ahead and connect it to the Y port. Before connecting to the Y port, we want to go ahead and clean off the Y port with an alcohol swab. Go ahead and let that dry. I'm going to go ahead and take the cap off the extension kit. I'm going to go ahead and throw that out now. I'm going to go ahead and inspect the line again, make sure there's no bubbles or air. Now I want to go ahead and connect my extension set to the Y port now. Lock it with the lure lock. Once both my bags are set and tied, I'm going to go ahead and attach my IV lure lock to the patient. Also, you want to make sure that the IV bag is, or whatever you're administrating via IV, is at least 30 inches from the patient's IV site. And we hang the medication bag a little bit higher than the fluid bag. Once I'll go ahead and connect it to the patient. Once I connect it to the patient, I'll go ahead and assess the site, make sure there's no infiltration, no pain, no discomfort for the patient. Once that is done, I'll go ahead and make sure the patient is in a comfortable position, ask him if he has any questions. Go ahead and lower his bed if you raise it to waist level. Put the rails up for safety. Put the call light within reach to make sure if he needs anything to call us for anything. And then we'll go ahead and clean up our mess. Go ahead and get everything, our trash, our bag. I'll go ahead and throw it away. After that, we'll go ahead and once again, perform hand hygiene. And then go ahead and leave the room, and then make sure to document everything in the chart that you documented, that you gave the medication, what time it was, what route, right dose, and you go ahead and chart it in the MAR, and also chart it in your patient's chart that patient tolerated well, education given if it was done. Yeah, that's about it.